My name is Roger Hartle.
I'm Dr. Michael Solly.
We're here to answer your top questions about adult back pain.
When should I see a doctor for back pain? One of the things I think people often wonder is when should you seek care for your back? If you do have issues that are impairing your independence, where you're relying on other people to do things for you, you're not able to participate in the activities you used to love, you're having issues with getting around, certainly seeing a physician in those circumstances is very appropriate.
What can I do to prevent back pain? One of the most common reasons why people develop back and neck issues is really the lack of exercise. Therefore, I always encourage my patients, with or without surgery, to try to stay in shape to prevent further problems related to their spine.
I oftentimes joke with my patients, I say, rest is rust, motion is lotion, and movement is medicine. While there may not be a perfect way to prevent back pain, there are a lot of ways that we try to reduce the risk of injuring the back. One of the ways that we really need to get the spine to get healthy and strong is to instill in the person that exercise really needs to be consistent.
And that's what I tell my patients. I think at the end of the day, exercise is better than no exercise. A lot of patients ask me, is this a pinched nerve? As a spine surgeon, especially as a spine neurosurgeon, I obviously see a lot of patients with back and neck pain. You can see here on this lumbar spine, those nerves coming out at every level, and those are the nerves that actually then travel down into the leg and innervate the muscles and the skin in the leg. Now, if somebody has a pinched nerve, all that means is that one of those discs connecting the bones is pushing on the nerve, and that causes electric pain that shoots down into the patient's foot or leg.
Dr. Hartle, that's a great point. Patients will oftentimes describe an electric shooting pain as you described. In the situations where they cannot feel things anymore, they're losing the control of their limbs, there are an array of different non-surgical treatments that we do, ranging from medications to physical therapy. Sometimes time is the main thing that will get someone better, but we just need to manage those symptoms to allow for that time. For an adult, what sports are safe for my back? As clinical director for sports medicine, I'm often asked what sports should I be doing. In general, exercise, sports, and athletics are good. So very simply, we do know that things that take pressure off the back is really the way to go. So swimming is oftentimes one of those low impact, low stress activities on the spine.
Dr. Solly, that's a very good point. And the reason for back and neck pain can be just muscular, can be bad posture, it's work related at times. So it's not always a serious or life-threatening problem. It can be just habits and bad posture. When is surgery recommended? Surgery is a great solution for the right patient, for the right problem at the right time, but it's not always that surgery at the end of the day is necessary or is the right thing to do. That's the benefit of working at a place like Ox Spine Hospital, where world-renowned physicians work together and for the purpose of making the right diagnosis and coming up with the right treatment plan.
Oftentimes when I see patients coming into the office, a lot of them are scared or reluctant to consider the idea of surgery. There's a lot of non-surgical options that we have for treatments that range from physical therapy to build the spine, build the core, work on good postural habits.
Dr. Solly, and that reminds me of three things that I always tell my patients. Those are my favorite exercises and little tips that I give to my patients. One is back support when you're sitting, and you can put a little pillow behind your back so you're really sitting straight. The other thing is posture control. You can lean against the wall, you tuck the feet against the wall, and you touch the wall with the back of your head. And you do that for 10-15 seconds 4 or 5 times a day, and it really practices your posture. Finally, neck support at night. Put something under your neck that supports your neck, but don't have it flexed, have it like slightly extended with a light pillow under your neck to support the neck.
Dr. Hartle, that's a great point, and it's never too early to see a physician, but it can be too late. So we really want you to make sure that you get the care that you need. If you have additional questions, visit our website at nyp.org/oxspine, and thanks for watching.